I'm Dr. Gavin Macgregor-Skinner. I'm the Senior Director of GBAC. I joined ISSA May 2020. Now, what have I learnt during the COVID-19 pandemic is that cleaning for health is critical. It really should be part of the national security agenda. And more importantly, we kept so many facilities and organisations and places open. The cleaning companies and the cleaning workers were never recognised. And it's important that if you look at the US Department of Labour or the US Centers for Disease Control, CDC, they have a list of critical, essential workers during any disaster, natural, man-made, intentional, even infectious diseases. And unfortunately, the cleaning employees, the staff, the janitorial staff are not on that list. And that's what's coming next, is to get them recognised as being part of the critical infrastructure of our society. So now I'd like you to meet the entire GBAC team.
Patty Olinger. I started with ISSA as the Executive Director of GBAC in September of 2019. John Barrett continually says, it was a great decision right before the pandemic to bring on the Global Biorisk Advisory Council. And, with my background in biosafety, biosecurity, biorisk management, and that has been my passion, I had no idea really what I was stepping into. And of course, no idea right before a pandemic. What I've learned is that the world needs more of what we provide here within ISSA and GBAC. It is one of the things that, what is clean? And, who can better define it but ISSA? I mean, what is routine cleaning? I always love that when you look at a lot of our especially with COVID-19, it's one of those things where as long as people are routine cleaning, we don't have to worry about surfaces. Well, what is routine cleaning? And making sure that we're doing hygienic cleaning, which really is cleaning, disinfection. And if you're looking at it from a biorisk management standpoint, looking at the whole aspect of indoor air, because that's part of your risk assessment. And so what I've learned, man, there are so many different things. It's hard for me sometimes to focus in on one, but that there's more for us to learn. There's more for us to connect with our members of ISSA and the world outside of ISSA, the clients that we provide services to, whether it's hospitality, which includes, our hotels, spas, restaurants. I mean, we all want to go to restaurants, and we want to make sure that what they're doing to make it safe for us to come is the right thing to be doing. Our what we call mass gatherings of whether it's a convention center, to go back to trade shows, to be able to go to a concert, those performing arts centers, theaters, they're really important. Sporting events, we all know that sporting events, when we see our sporting events amazingly coming back and in full-fledged, we know that there's a healthiness to that. We saw that after other, critical disasters in the past. When you look at our education is we're learning that it's not just about, sending them back to school, but what are the schools doing to have that emergency preparedness in place that prepare, respond, recover, and for us also building resilience. What do they need to do? There is not a discipline out there, or what we call a vertical or our destinations. Everybody has been impacted, and it has brought the awareness of what we're doing here within ISSA and within GBAC and the other divisions within ISSA. It is so critically important that we, educate, we bring awareness, and we are here to have an impactful meaning for public health preparedness, for the safety and the health of the environments that we live in today and for the future.
My name is Kristen Foster, and I've been with ISSA GBAC since July of 2020. And really what I've learned since being part of this group is that cleaning is just not to make things smell nice and shiny, which I do at home, but I've learned that it's really a lot more. It's about disinfecting and cleaning to get rid of viruses and really to keep us safe.
My name is Don Terry. I started with GBAC in May 2021, and a few things that I really appreciate about this company is the teamwork that we have, the community that we've built, and through that we're able to create a successful company that can affect change in the world. And to me that is very important, and I'm happy to be a part of it.
Hi, my name is Tony Vorsorn, and I've been with ISSA since January of 2021. And what I've learned so far in my time here is that it's really critical to ask the right questions. And being part of the Worldwide Cleaning Association, I feel it's really important that we help all our customers ask the right questions.
Hi, my name is Lana Varabei. I've been with ISSA since March of 2021. I do financials for GBAC, and I really enjoy working with GBAC team. Based on the financial data, I learned that customers keep extending their memberships and keep repurchasing new services, meaning that GBAC provides services of a higher value in this market.
I'm Steve Arehart. I am the Director of Technical Operations for GBAC, and I joined in May of 2020. What I've learned over the last 18 months or so is really the critical need and critical gap for education as it relates to the cleaning industry and its effect on infection prevention and infection control. I think the gap exists not only with professional cleaning industry and the education for tools, equipment, and chemistry and being able to properly utilize those, but also for managers of facilities and really closing the gap and understanding what are they paying for when they have someone come in and clean, and understanding this concept of cleaning for health versus just do I walk in and does it look nice and does it smell nice. So I think that's where we fit in with filling that gap in utilizing our knowledge of infection control and biorisk and biosafety to bridge that gap between cleaning and infection prevention.
I am Claire Lind. I have been part of the GBAC family since September of 2020. What I have learned in this past year plus is that cleaning and disinfecting are completely different. One differs majorly from the other, and it's something that we all can learn a lot more about. And moving forward, cleaning and disinfecting will be forever impactful in all aspects of business.
I'm John Adkins, and I joined ISSA in 2009, and I've been working with the GBAC team since 2019. My favorite part about it is working with our customers and our team to develop programs, services, and solutions that make the world a cleaner, safer, and healthier place.
I'm Maureen Carroll. I have been with GBAC since August 2021, and I think my biggest takeaway since joining GBAC has been our process of risk assessment and risk mitigation. So going into this pandemic and having, just cleaning frantically and cleaning all surfaces really isn't a sustainable approach to long-term cleaning for health. So we really pride ourselves on developing sustainable cleaning practices for long-term beyond COVID-19. So that's been my biggest takeaway.
Katie Cook. I started with GBAC in May of 2020. What I've learned through the past year and a half with GBAC is that people truly care. They want to do more training. They want to really help the frontline cleaning staff learn and develop and grow. They just don't know how or have the tools and resources to. So overall, people really care and want to improve their processes, their view, their training for their frontline staff and their guests.
Hi, my name is Mark Craven. I'm a sales executive with GBAC. I've been with them since June of 2021. The things that I took away from my first few months here at GBAC was the scientific differences between cleaning that we've been doing and the cleaning that needs to be done now. Cleaning is important for the way that the viruses are constructed. Viruses and bacteria are different. Those kinds of things I not only learned in what they were, but how the way we create protocols that allows an environment to be attacked and conquered with the environment that you're in, safe for not only you, but your employees, your customers, and anyone who comes and visits your facility. If a service or a facility is GBAC accredited, the people that come into the facility, the employees, the ownership, the stakeholders, They all know that they're getting in an environment in which they're safe. And not only are they safe when they're there, their families know that they're safe when it's time for them to come home. They're not in a place where they could bring danger into the home. The other thing was that if there's a future pandemic of any kind, the GBAC protocols are built to prevent the loss of service that many of our institutes have had before this. So we give you the safety, the environment, and the accreditation that allows you to stay open when other people may close. It's a way to protect your revenue source, and the protocols change based on our science and based on what we see as the pathogens coming down. We have experts in place that are watching this all the time.
So my name is Katrina Brown. I started in August of 2020, and something I've learned about the cleaning industry is that there's an order that you have to do your cleaning and disinfecting, and you have to clean for the soils first, and then you disinfect. If you want to disinfect first, you still have to clean for the soils, and then disinfect again afterwards.
Hi, my name is Joyce Hossman. I've been with GBAC since July of 2021. The biggest thing I've learned is dwell time. Who knew? I'm used to picking up a cloth and wetting it, wiping it, rinsing it. Who knew you had to let it sit on before it worked?
Hi, my name is Asha Vadlamudi. I started with GBAC in August of 2021. And one of the things I've learned since working with GBAC is the importance of identifying the different surfaces that you're cleaning and disinfecting, because they require different tools, different equipment, and different disinfectants.
Hi, I'm Kristal Coloney. I have been with ISSA since January of 2020 and worked with CMI, then moved to GBAC in March of 2021. And one thing I learned from CMI and also from GBAC is working with service providers and their employees. They're looking for training. They are hungry for training. They want as much training as possible, and they want it to be easy for them to follow along.
Hi, my name is Fanta Jatta. I've been with GBAC as an intern starting August of 2020 and now employed full-term as a GBAC analyst. One thing I have really learned is that risk assessments are a very essential part of cleaning, and that cleaning is not a one-thing-fits-all.
Hi, my name is Sydney Schauer. I have been with GBAC since August of 2020. One thing I have learned from GBAC is that there is a difference between cleaning and disinfecting, and it's not just one process. Cleaning involves the removal of soil and dirt from the surface, and disinfecting involves the inactivation of bacteria from the surface.
Hi, I'm Hannah Wright. I've been with GBAC since August of 2020, and my background is in public health, and in public health we talk about all of the factors that affect individual health, and we talk about where we live and the grocery stores that we have access to, but we never really talk about how cleaning and disinfection affects our health. And that's something that GBAC has really taught me over the year, how cleaning and disinfection is crucial for infection prevention and keeping our community safe and healthy.
I am Melissa Wernersbach. I am the GBAC Education Manager, and I also handle the STAR report. I joined GBAC October 2020, so the pandemic was in full swing, I would say at that point, and it's been a wild ride, I would say, from a lot of different angles. I think as just a human trying to navigate it, but also as a mother of a small child and having to navigate virtual school and no stores for a very long time. That was hard, you know, and trying to convince my kid that he has to wear a mask everywhere he goes. But now he's better at it than I am in some days, so that's good. I think the thing I've become the most aware of is the cleaning or lack of cleaning around me. I think it's the first thing I notice. We finally ventured out after 18 plus months to a hotel back in July, and I was a nervous wreck, and I was in a STAR accredited facility, and I noticed everything around me, rather the lack of everything around me. And I noticed all of the staff shortages and how stressed out the cleaning crews were because there was hardly anybody there. You know, there was like two people for the entire facility, and it's a big facility. So I think you just become more, I don't know, aware of the things around you, and you're more cognizant of where's the hand sanitizer and don't stand too close to me. And it's funny how it doesn't take very long to have that type of shift in your thinking. And I think the biggest indicator for me, which I have told people before, is when I dream sometimes, now I dream and I panic when there's no mask in my dream. I will literally say, oh my gosh, I forgot my mask, and then realize, oh, that I dreamt that. And that's sad to me, actually. But yeah, I think the shift has been pretty interesting. GBAC helps people prepare for this kind of stuff, right? They promote all of the right protocols and all of, if you don't know what a protocol is, or if you don't have systems in place, GBAC helps with that. And if your cleaning staff does not know what an infectious disease is or how they get that disease, then they can come on over to the academy and they can learn about that. And what I try to do with the academy is I try to bridge the PhD with the everyday frontline cleaner, right? And that's a big bridge, to take something that can be complicated and make it so anybody can sit and listen and get something out of it and become better at what they do.
Hi, I'm Michael Diamond. I just started with GBAC. I will be the new Director of Innovation and Technology. What I've learned about GBAC so far? Well, the world is a dynamic place with new evolving chemistries, processes, ideas, and concepts coming to market. And organizations such as facilities, service providers, and manufacturers, they need a clear voice that is unbiased and focused on the science and can actually talk a straight story. GBAC provides that through as an organization. Unlike other organizations that are narrow in scope, such as in healthcare, GBAC provides a full compass view of all environment types, really focusing on risk assessments for individual needs and strengths and weaknesses, which then chemical manufacturers, equipment manufacturers, service providers, and facilities can actually understand from their perspective how to address cleaning and disinfecting. And that's what's important. And I believe GBAC is probably the world's premier organization for that.